Today, a new handbook to optimize outcomes with germline and somatic testing for metastatic prostate cancer.
Overall, I think the handbook could give anybody the guidance that they need to set up their own program.
That's Amy Smith from Meredith and Jeannie Ray Cancer Center. You'll hear more from her up next. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Prostate cancer is one of the most prevalent solid tumors in men and accounts for 6% of cancer-related deaths in the U.S. Staying current with rapidly evolving advancements in cancer care is a constant challenge for clinical teams. That's why ACCC created the Metastatic Prostate Cancer Care Handbook, a guide to optimizing outcomes with germline and somatic testing. A practical resource offering actionable strategies to overcome common barriers to germline and somatic testing in prostate cancer. Today, we're speaking with two guests who have piloted this project at their cancer centers. First up, Amy Smith with Meredith and Jeannie Ray Cancer Center is here to tell us about her experience.
Working directly as the cancer center director, my role there is kind of what got me involved with this project, and our affiliation with ACCC, being able to see when there are process improvement things going on and areas where we struggle. We are a really small cancer center. We have one oncologist. And so part of the reason that I wanted to get involved with this project is because metastatic prostate cancer is one of those diagnoses that we see quite often. So we really just want to keep up to date on what's going on. And as you can imagine, when you are one oncologist and you're a hematologist, it's hard to really keep up on everything that needs to be done. And so what I wanted to do was get my staff involved so that they were kind of, especially our nurse navigator, being able to recognize what testing we needed to do, when we needed to do it, and how we roll that out seamlessly to our patients. So it takes part of that load off of the providers.
You helped lead the project. Did you then see any immediate impact with the pilot on your patient care?
Yeah, so I think the immediate impact that I felt with the entire team was we really dug in to figure out what these tests really meant. Because when you look at the differences between germline and somatic testing and all of the different things that go into that, we really were unsure. And that's, one thing that I can say, we wanted to learn more. And so as a team, we dug in and we looked for definitions, and we went to the ONS website and UpToDate and NCCN and just lots of sites to help us gather the information so that, number one, we could learn ourselves. And then the other thing that we really kind of dug into was looking at how do we explain this to patients so that they understand. The third thing that we pulled from this was we were able to work closely with the urology team because they're kind of off doing their own thing. And we wanted to be able to collaborate better so that we're either helping them or they're getting the ball started and we're finishing the process. And so we were able to really meet with them and just talk about what are their expectations of us. And the way that this kind of lined out is we have a new urologist here to the hospital, and he wanted my team to take over all of the test ordering. And so that's just now part of our process. So when he gets a new referral, he just reaches out to our team, and we start the testing early in the game so that we have all of the results by the time the patient comes in to see the oncologist.
Let's talk now about the handbook and what purpose that served for your team.
Yeah, the handbook specifically, the one tool that my staff really liked were the resources page of the handbook. It gave us some great things to go out, and that's when I talked about previously about us going out and getting education and informing ourselves on things. We used a lot of those resources that were on the tools and resources page of the handbook. And so it also gave you links to lots of different references that we could give patients that we knew these are reliable resources that patients can count on. And it helped us sort of devise what we felt like we wanted to educate patients when we were talking to them about the testing. The other thing that the book did is it really gave us a good outline on what our deficiencies were, where we wanted to go with testing, and it lined out different phases and just pretty much set it up so that it was easy for us to follow. And as a team, we all had our different tasks that we wanted to accomplish before the next month when we reconvened. And overall, I think the handbook could give anybody the guidance that they need to set up their own program.
I would imagine, because you said you see a lot of these patients, that this was a big change for your whole practice.
The biggest change is the knowledge, that everybody is sort of expected to know the new things in oncology all the time. And we know that oncology changes every single day. There's changes being made. And so for us, it was nice to have these resources coming from the handbook to be able to say, hey, these are credible. We're going to go here. We're going to get the information we can, and we're going to build our own program based off of this information. So it kind of took the guesswork out of what we had been struggling to find for several months. I mean, even the last couple of years, this stuff has all been coming down the line more and more. And for my team, I think we're just struggling, right? I think small practices specifically are out there, and they're trying to keep up with technology. They're trying to keep up with new tests that need to be done and do the best for their patients. And we can admit that that's really hard to do. It's hard for us to always, keep up when we only have one oncologist. He's busy practicing. He can't be traveling to conferences all the time. And the staff, I think for them, it just really empowered them to be able to say, hey, we know exactly what we're going to do. We get this referral coming in, and we can just take the ball and go with it.
How do you measure your progress or success? Do you have any benchmarks or metrics you were looking at?
We really didn't. We really just kind of wanted to look at, do we feel comfortable with this? Are the patients understanding the information that they're getting? And are we able to start treatment on a patient in a timely manner because we have the information we need? And I think up to this point, we've really been able to say before the patient comes in to see the provider, we have all of the testing done ahead of time. And for me, that you can count that as a benchmark because we know we're doing the right thing. I think early delivery of care is one of the challenges in rural areas. And that's one thing that we really try to improve upon in all of our treatment areas is how do we get the patient in here and get them going on treatment quick? And you don't want to have them coming back and forth to the clinic several times because you need additional labs or you need additional testing. You really want to get that done one and done before they're ready to start treatment, and hopefully as soon as you can have them be started on the correct treatment for what they have.
What does the future look like then? Are you planning to build upon this program?
Yeah, for sure. I think we can only keep learning, right? And this is very new to us. And I think our program building off of the book, it really does give you the groundwork that you need, but you can always reflect back to it. And my plan is with this team is let's just keep going back and figuring out how do we keep getting better. And we really value process improvement at our cancer center and making sure that we're always doing the best for our patients. And so I think the handbook really gives us the opportunity to go back and say, okay, here's some resources. If this isn't working, how do we go back and how do we revamp it and use something else? And I think all cancer programs could use the pamphlet or the booklet in the same way.
Up next, we hear from Andrea Murphy at Mary Bird Perkins Cancer Center on how the guidelines in the prostate handbook have been integrated into her center.
Really, what I've done so far with everything is I have just kind of reminded a lot of the physicians and the providers that these are the guidelines. Of course, several of them were aware and kind of already implementing that, but just to kind of let everybody know that this is the guidelines and that we are here to help in any way I've, of course, the providers, and then I've kind of involved like navigation teams and nurses and things like that because, I think everybody kind of coming together to be aware of those guidelines has helped and will help in the future, of course. So really, so far, kind of what we've done is kind of just increase the knowledge and kind of increase some of the awareness of the resources that we do have available at our center for some of the other barriers that, I know we may get into a little bit more, but really that's the biggest thing, kind of trying to putting it almost into like a protocol at this point. I don't know that we have anything specific, but, kind of making sure that any new diagnosis, metastatic prostate cancer or progression, it kind of almost just gets included in the treatment plan.
Andrea, what motivated your center to focus on improving the processes around germline and somatic testing?
Really, I think the biggest barrier was lack of knowledge of the guidelines. I think a lot of people were surprised, definitely with germline testing, that all metastatic patients met the criteria. Also, somatic testing, that they do recommend it kind of first line because it doesn't always affect the treatment, things like that. So I don't know that. I really think that lack of knowledge of the guidelines was the biggest barrier.
Financial toxicity is definitely present in many facets of oncology. What does that look like for you and your center when you're treating metastatic prostate cancer?
It impacts it in a lot of ways. Obviously, we do genetics for all of the state, and so we do a lot of telehealth and things like that. So we do have issues when it comes to like access to equipment to do telehealth stuff. So we kind of work around that, either by doing phone calls or having them actually go into their nearest center doing telehealth. Transportation, people have difficulty getting to appointments and things like that. So we have lots of resources at our center to help with that. When it comes to the actual testing, I think it's a lot of miscommunication and misunderstanding because really the labs have gotten so great with their patient assistance programs and they're just in general, like the type of insurance that they cover and the testings that they cover. So I think a lot of that is actually miscommunication. So just making sure everybody is aware that the options we have now are so much better than they used to be with those types of testing. And then specifically at Mary Bird Perkins, there are, donor funds and things like that, philanthropy funds specifically allocated to genetics. And not a lot of people in the center know that. We're very large. So I've just kind of been, again, just like the guidelines, kind of increasing that knowledge. I've been trying to do that as well. Make sure that everybody's aware of the options so there's not really any misunderstanding. And then also knowing that we do have resources to help with that.
How are you measuring success as you go through this pilot program?
It's great because it's happened to just line up with our cancer committee, the site that we chose for this year. So basically, I have had the most amazing, wonderful help from our tumor registry because they're already pulling all prostate cancer patients and then kind of making like a spreadsheet for us. And I'll just go through there and kind of pull out the metastatic patients and then manually right now just kind of digging through charts and things like that. Of course, with healthcare and electronic health records, that can be difficult as well, with different systems and things like that. It just happened to line up that's been so super helpful because they're pulling that data already. And of course, that's extremely time consuming. So I've just been going month to month with the data she sends me. We've been pulling it up to see who has met the criteria for it and who has actually had the testing. So we've been tracking it like that.
What would you like to leave our guests with today?
The only thing I will kind of mention, as far as barriers that we didn't really talk about, I've kind of had some, I guess, pushback. I don't know the correct word to use, but basically, when it comes to somatic testing, and full disclosure, I am certified in genetics and have always done like hereditary germline type of testing. So somatic testing is still something that's pretty new to me and that I learn new things every day. But kind of from some of the feedback that I've gotten is that some providers are hesitant to order somatic testing on all metastatic prostate cancers just because it doesn't always change their treatment. So if it's castrate sensitive, from what I understand, again, this is not certainly my area of expertise, but kind of what they've said is that in castrate sensitive prostate cancer, it doesn't necessarily change the treatment. So I think that's kind of one of the biggest barriers is that they they don't want to do it kind of first off, right on all metastatic prostate cancer patients for that reason. But I have shared some of the feedback that I've gotten from you guys, bringing that up, that, the NCCN recommends it. It kind of just basically it helps as treatment goes on to kind of have all that information straight right off the bat at first. So just to kind of mention that is a barrier that I've kind of heard some feedback on.
Thank you to our guests today and to AstraZeneca, Johnson & Johnson, and Pfizer for their support. For more resources on prostate cancer care and a link to the ACCC Metastatic Prostate Cancer Handbook, you can check out the show notes. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.